We're live. All right. Hold on a second. Hey everybody, it's Bill the Knee Pain Guru. Today is Saturday, September 19th maybe, ish. Today we're going to talk about full range of motion after ACL surgery. This one is near and dear to my heart. It's a good one because that's what I had. That's what the challenge that I had. That's what got me into all of this to begin with. Before we get into that, I want to show you what my daughter and I have been working on today. So all of those are mushroom logs. They have a pipione. It's a type of mushroom that you could see the little pink dots on there. Those are holes drilled into the that's oak, white and red oak, and they're inoculated with a mushroom spawn inoculator. This is the spawn that they use. Let's see, here we are. So that's what I do for fun when I'm not helping people with knee pain. Okay, so here's a question. Today it's from Stefan Andrei. I'll read it here. Let's see what we got here. It says, had ACL meniscus surgery in 2009. That was 11 years ago. In the last couple years, I've started developing pain that has become chronic. The doctor is telling me that a possible solution can be artificial meniscus. The only thing is that nobody has addressed the fact that I do not have full extension on this knee. It is not that far off, and I've noticed that by passively and actively extending the knee, it actually increases my range of motion a little bit. It gets almost the same as the healthy knee. My question is, can I further increase my extension even though it's been 11 years from my surgery? Common question, common problem, common issue. And the issue is whether or not a person's had ACL surgery, that people have those issues. They have issues like that with knee replacements. They have it with meniscus surgeries. So the full range of motion after a surgery is separate from the surgery. What's important to understand is, and the theme that permeates through all of these challenges with range of motion after a knee injury or after a knee surgery, is the fact that the nervous system has responded to tense up to protect the knee joint from getting injured further. ACL, I could speak for it, there was a trauma in the initial injury. There was a trauma in the surgery. The body experiences a trauma from that. What ends up happening is it creates a tension pattern that the bones in the lower leg and the bone in the upper leg do not line up correctly in a way that allows full extension and flexion of the knee. Most people think there's just one range of motion, that's the leg extends and it bends, but actually there's small intrinsic movements in the joint. Slight tilting, slight forward and back, side to side, apart and together, and rotation. And these slight movements that get held in the joint, in the rest of the body as well, what happens is these intrinsic movements prevent the full range of motion of the joint from fully extending and fully bending. Now, like Andre was talking about, he can, if he actively extends the knee, he can increase the range of motion a little bit. So he's working on a muscular level in terms of increasing the range of motion. That's very much like conventional physical therapy or conventional exercise. On some level, you're going to affect a change. But on the deeper level, the neurological signaling that is sending the messages to the muscles, to the tendons, to the ligaments, to the fluid, to the fascia, to the joint, is preventing the full range of motion in the joint. For me personally, because I had this very same injury, I had ACL reconstruction, and that was my challenge, being able to fully extend my left knee, fully bend my left leg, getting my heel to my butt, because I wanted to go back to judo and I wanted to throw people. And that's the piece where most people miss the boat in terms of what's going on with their knee. They're trying to strengthen the leg, or they're going to go get another surgery, some sort of procedure that is supposed to create the space to increase the range of motion in the joint. And that's not how the body works. We have to look at it through the neurology, through the nervous system. We got birds all over the place. It's really cool. So if you got questions, please ask those in the comments section in the live chat. If you're watching the replay of this, enter them in the comments section. If you liked the video, you found it valuable, give it a thumbs up. Like and subscribe to the Knee Pain Guru YouTube channel. Turn on notifications for future videos. I do these, I started over this past week doing these almost daily. I do the live stream on the phone. It's a lot easier, answering questions. I print the question out, we're good to go. That way I can keep doing stuff around the yard. So if you do have questions, enter those in the live chat. I'll see those. And then, what's the other piece? Oh yeah, you want to know your next step. Like, what do you do here? Oh, this is great information, Bill. Now what the heck do I do? You can head on over to the Knee Pain Guru website. I have a video over there that will describe to you more in depth what I'm talking about. And I also have a coaching program where I work with clients remotely. I don't see anybody in person. Everything is remote. And I guide and direct you as to how to release these patterns that are going on in your knee so you can go live the life that you want, so you don't have to think about your knee. So let me check questions. Let's see. No questions that came in. Cool. Okie doke. I'm gonna get back to my mushroom logs. Actually not. My daughter and I are gonna go eat breakfast. Or gonna go eat. Anyhow, thank you so much for watching. Appreciate your time. Once again, give the video a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel, and turn on notifications for future videos. Take care, everybody. Have a good one. Bye-bye.